Good morning and welcome to everyone. Thank you for coming and joining us to have a quick chat through what's going on with regards to COVID care and digital technology. We'll be looking at what's been going on in the marketplace at the moment, having a discussion around how organisations in social care, particularly with adult specialist care, have been looking at prioritising their digital investments, what their key issues have been to date, and where we're looking in the future to move towards. So, as we've seen, healthcare is moving towards a more integrated approach with social care. The budgets need to align at some point, and we're starting to see flows of money change, pathways change, and we need to be in a place where we can leverage all of that. And no one better, really, than my first guest to talk to around what's been going on the marketplace. So, from Radar, I will be speaking to my colleague Chris Sharman. He will walk through what's been going on with regards to the different types of digital requirements, and then the personal experiences. We'll be speaking to Russell Day from Sequence Care and for Misha Fontenot from Walsingham Support. So off we go. If I can hand over to you, Chris.
Guy, my name's Chris Sharman. I'm one of the quality and compliance specialists here at Radar, and in my role and what I've learned over the time is that we know that care providers face many complex challenges. Firstly, there's an ever-changing regulatory environment. That might well be the CQC, the Care Inspectorate in Wales or Scotland, or even in Northern Ireland, the RQIA. It's also safeguarding regulations and many other things that they have to deal with. This has always presented many challenges, but the COVID pandemic has added another layer of complexity to this. For example, how does the CQC perform inspections while minimising contact, ensuring the safety of everybody concerned? Well, one way is that the care providers to provide much of their information that's required an inspection digitally, and this will allow for a reduced contact and the efficient provision of information that the regulatory bodies require. Another challenge that faces care providers that we're understanding is that the CQC and other bodies are looking at what degree of digital maturity is in place, and this looks to be a major focus for care providers going forward. So, however, Radar's not about making life easy for the CQC. We also know that ensuring quality and compliance is complex, time-consuming for all care providers, and especially so if this is managed in a multitude of manual systems, which is quite commonplace at the moment, probably in about 70% of the care providers in the UK. Radar has been designed and built to help all care providers and allow them to simplify the complexity of their quality and compliance. Using Radar, care providers can ensure the effective management of incidents, risks, audits, and ensure the competency and compliance of the whole team. What's more, using digital technology for compliance can also provide many other benefits, such as becoming more efficient, saving time, costs on consuming admin, being able to spot trends and thus put in place interventions earlier and more preemptively. Because of the shift from the evidence-based outcome because of the shift from an evidence-based to an outcome-based regulatory environment, it's more important than ever that care providers can demonstrate not just their compliance, but also their ability to use the data to ensure lessons are learned, and those lessons are shared and implemented across their whole organisations. A digital environment will make life much easier for care providers to transition to this outcome-based environment. So I'm really interested today to find out how some of our customers in Walsingham and Sequence are doing these kind of things. So I'll hand back over to you, Guy.
Thanks very much. And that's a really interesting point you raise around digital maturity. So there's been a lot of attempts at understanding digital maturity, whether that means handing out iPads and having the ability to use NHS Mail, or much more around the internal capabilities in terms of data management and compliance and various other components. I'm not sure we've got somewhere yet that allows us to really understand where each organization is on their journey in a systematic way that it makes it comparable, and certainly not for a commissioner to be able to understand their own capabilities internally and maturity so that they can move forwards and action things, but equally on understanding their map, almost a mapping of their whole area to understanding cohorts of individuals suffering from the same challenges. So what I'd really like to do now is hand over to Russell to ask a similar question around how's your organisation been coping through the start of COVID, and how have you adapted your digital journey, and what's been your experience of solving some of those solutions? Can I hand over to you now?
Thank you very much, Guy. We've had a very interesting journey. In fact, we took a decision early last year to take on quality and compliance through Radar. And as it fell, our implementation journey took place in the middle of the first lockdown. So it was a point in time which was, I guess, one, a question of whether it was going to be too difficult. The second point was, would it be business beneficial at the time? Actually, what we found is, in terms of our ability to monitor from a remote base, and what we have to remember is how geographically spread we are as a group. Head office in London, and we spread as far away as Basingstoke. But more importantly, as a management team, we spread from Whitney Bay down to Brighton. So in terms of our geographical spread as a management team, it's very important for us to be able to remotely monitor it. So it's essentially become our tool to be able to monitor quality from a remote base. And I don't think, in hindsight, without it, our previous quality assurance framework, as it was at the time, which was very much manual, as Chris kind of alluded to, in 70% of businesses, would have actually stood up to the test of time. So I think, from a point of view, in terms of our digital journey through COVID, absolutely no doubt it's been 100% of the benefit.
I was going to ask, are there buckets of thought process you have around how you put your different sections of requirements in place? How do you think about your digital journey? Are there safety elements and capability elements and staffing elements? How do you prioritize and think about those things as an organization?
Our first point of call, really, in terms of digital, is the capability of the organisation to adapt and change. So we work in three distinct areas of the group. So we've got three distinct businesses which operate. We operate as a group that are independently regulated with the regulator. So from that point of view, it's really looking at and picking the right place to implement. So that's the number one point in terms of digital change. It's people's ability to embrace and kind of implement on the ground. Because that was kind of the biggest challenge and the most important aspect of this. We were implementing it from a remote base as well, so there was no face-to-face contact, and this is how you're going to work from now on. It was either by email or through Teams. So yes, in terms of putting it into buckets, as you'd say, the first bucket really is the capability of the business to take something like this on. And then the ability, and then working through what's most important to the business in terms of making sure we're safe, caring, responsive, effective, and well led. So we took it from a point of view where we needed to make sure that we were safe in the first instance. So instant recording, safeguarding management, audit processes, and those are like types of things. At the back end, we're more looking at the well-led, so the workforce compliance aspects of supervisions, appraisals, and things like that.
Okay. And was there a process that you went through to prioritize all of the different things that you had to consider?
Yeah, so in terms of the process we went through, to what we needed to consider is we looked at what we currently had, what was working fairly well, what wasn't working so well. So one of the issues we had was things like incident management. Yes, we had a way of recording incidents through a process of Excel spreadsheets, essentially. But what we didn't have is the ability to investigate, gather information remotely. And that was all done face to face. So that would involve people such as myself, or operations managers, or operation directors going actually to services to acquire that information. Actually, by implementation of Radar now, we can simply, the incident is recorded, if we've rated it as a high incident or safeguarding alert, we could instantly ask for that information to be attached to the incident, and then it's there for us to review, and we can take
Thank
a
you very
judgment on
much.
it.
And Misha, I'm guessing you've had a fairly similar experience in terms of some of the things that were challenges early on within Walsingham. So how did you go about these sorts of challenges? Do you have similar approach? And also, I guess culture must be a major issue when deciding to make some of these sweeping changes. How did you address both those requirements, really, in terms of the digital requirements and needs, and helping the organization adjust?
Walsingham Support's used radar for well over 5 years now. We had a paper system just like Sequence, where you sent us Form A, Form B, Form this. We've converted to radar, so we're very used to using radar. When COVID struck, there was a moment of, oh, it's coming, and we booked in meetings very conveniently to set up what are we going to do and all these things. And we had booked the meetings on a Monday, and on the Tuesday, we realized that there were 8 people all using phones and emails to try to capture data on an Excel spreadsheet. And we thought, what are we doing? We have radar. So what we did is we called radar. We said, we know you're prioritizing this. Can we get this immediately? They said, no problem. And we developed, I call it COVID, because we've got COVID events where we can log where somebody's had an incident in the public, or a person we support might be showing signs. We have COVID testing where we record that on a workflow so we can see exactly who's tested, what their test results are, whether it's a person we support or staff. And then the third COVID is the vaccine. Who's had it? Who's had number 1? Who's had number 2? Where are they getting it at? Because with the initial data with COVID, we were hearing about some of the testing centers having some flawed testing kits. So we wanted to gather where they got it, because then we could drill down immediately within 2 minutes which other people had been tested at that place and trigger them to go get other events. And when we did the COVID kind of alert system, we have it going to where every time one is logged of the COVID events, it goes as a trigger to our super users. So in the case of one of our services, we all woke up in the morning and there were 38 notices, with 18 of them being from one service. And we were able to target this service from all of our different teams based upon those emails. So we didn't need to individually call the services or contact an administrator to go, how many alerts did we have? We all knew immediately, ooh, we need to target this service. What can we do? And provide that support. But in the early days of COVID, there was a bit of slow buildup, thinking we'll have time to do this. And at the end, it ended up being a 3-hour turnaround to, it's an idea to put it on radar. It is on radar, and it's a system. So our kind of betting in with making people use radar and getting them to understand that engagement and the change management is kind of a thing in the past for us, because when we get the new things, people are pretty keen. Our executive leadership team has a meeting every week about COVID to discuss current trends and things. And every week we just gather that information from radar, and we just push some buttons and there it is. And we're able to keep on top of every single thing. Last week was very tragic. This week was very good. And we're able to kind of see who's doing well, who isn't doing well, where we might need to support, which senior managers might need support. And it's been really valuable to us from that oversight and that responsibility to keep people in the know, in the system. And being able to interrogate the data quickly is vital, because we can run a report in 2 minutes that tells us Northern England's fine, Wales isn't so fine, Central's fine, but South hasn't had any vaccines. What's going on? And we could drill down to that and focus all our resources that are important to use in the right places. And while at the same time, like Russell says, you've still got your normal business as usual, your quality auditing, your measurements, your normal incident reporting and stuff. And all of that's just ticking away in the background while you're focusing on this new emergent need. So we've managed to put all that in the software, where sadly, COVID has become one of our normal business procedures. It is just another part of our system now. It's one we monitor much more closely, but we're able to do, just like Russell said, look at our self-assessments and services, quality auditing, measurements. We were able to, when CQC changed their format of inspections, Wales kind of went quiet, but CQC went really loud, and they said, we're going to now start doing the emergency support framework. So we took what they said they were going to do, dumped it into Radar, sent it out to all the managers saying, please do this on your computer. You're ready for the phone call. And then they did. So when the phone call came, they had their answers. They didn't need to think about it. It was over for them. And it was the same with the IPCC, the Infection Prevention and Control mechanism that CQC were checking. So when they got their phone call or their visit, in very rare cases, we did have 2 visits, but most of them were phone calls, and they were able to be confident in that moment, because it is nerve-wracking talking to a regulator. But if they did the self-assessment on Radar, they had their answers ready to go, bullet points, and then when the phone call came, they went, I'm ready for you, here's my paper, and they were able to run with that, because the regulator and everybody kind of went, we'll see how this goes. And there was a pause to emergency systems and auditing. And then it became, the regulators shifted to, this is going to be here for a while. This should be part of your normal business. And you should have all your systems in place. And we did, but we're ever involving those. So even at the moment, CQC's got a strategy out about a new way of doing, and we're looking at that, putting that into Radar, seeing what we're going to do with that. And we can just push some buttons and find out how everybody's scoring. We've been able to drill down to certain operational areas. So it may not be the entire southern region that's a problem. It may just be a certain operational patch. And then we can put mentors in from other really high services to those areas and kind of get them wrangled quickly, instead of waiting for reports to be created a long ways down the line. We're able to do it in a much more real-time thing. They've added something called business analytics, Radar analytics, I'm not sure. But it does it to your desktop, and I'm not that good with it yet, but I will get there. But we've done a lot more distance things, and Radar allows us to drill down on those immediately, which has been unbelievably important during this whole event.
Yeah.
Does that answer your question?
At the moment, it perfectly, actually, yes. And there's a lot of things coming down the pipeline because of the changes in how the CQC want to function, how integrated care is going to mean that we start beginning to see the crossing over of siloed budgets, and therefore the care pathways merging at various places. As a system, a health system, there is a lot of information that needs to be gathered. There will be new data points that are wanted to be gathered. And effectively, the health system is really going to need to work off of the data exhaust almost generated within organizations. And what would be good to know is, what do you think the sorts of data that you could produce and capture that could then be used to inform the CQC and other regulatory functions, as well as decision makers who take the aggregate of a local health economy to make better decisions? What information do you think you could gather on the fly as you're doing the job through Radar or other systems that would make a big difference on them being able to assess you as a secure, safe, and better experienced operator? And I'll ask that, I guess first, you probably see some of this across the work that you're doing, Chris. So maybe something that Radar's envisaging around how to integrate all this stuff together.
Yeah, certainly. And I think Misha touched on it, the Radar analytics module that we brought out about a year ago now, I think it was. It was a real game changer for us from that point of view, because Radar is brilliant at collecting data and collecting all this information, but you've got to be able to use that data. You've got to be able to present it back to the right people at the right time. And that's what the analytics module does. It allows you to basically build dashboards with the key performance indicators that you want, but not just one dashboard. They can be very, very bespoke for each individual user. So if Misha's got a particular area of interest, she can target that with her dashboard, and Russell could do the same with the data that he's collecting. So and that's right throughout your organization, whoever's using them dashboards. So it really is a game changer from that point of view. And there's also the ability to develop that. We provide a range of standard dashboards that come out of the box, but there's also the ability to build your own and be really specific and bespoke about the information you get, and potentially bring data in from other sources, as you mentioned, Guy. There is lots of systems out there, and the more that they are interoperable, the better data that the organizations are going to be able to use for their quality and ensuring the safety of the service users. So yeah, analytics has been a really big step forward for Radar.
Okay, and I guess, Russell, in that context, how do you think that the new emerging world with more surveillance over intervention is going to impact the way that you work as an organization. Are there tools that you're expecting to put in place that help in informing that process? Are you thinking about the sorts of metrics that are coming your way, or is there advice you'd give to the CQC around the sorts of metrics they should be looking at if you had the chance?
I think it's interesting. So since we've kind of implemented Radar and brought all that data through, as of next month, we're enhancing our own internal quality assurance framework in terms of the KPIs that we're reporting on the basis of the data that we can now extract directly from Radar at a touch of a button. So we can really drill down onto real specifics. And one of the things you talked about integration. In fact, this week we've had some input from a crisis team in one of the services for one of the service users, and they came with a whole rack of paper that they said, you need to fill this in, that in, for us to be able to, to deliver some support and interventions to this service user. And what we're actually able to say is, hold on a minute, we don't need to fill this paper in. What we can do is take what information you want. We'll build something directly into Radar, or in fact we may already have it in Radar from our own reporting, and we can give it you electronically on a daily basis if you want it. There's no need for you to come and collect paper and take paper away and kind of interpret a support worker's handbook writing. We've got it all electronically. So actually, from a point of integration and being able to drill down on information and bring additional information into our own reporting processes for whoever it might be. Radar's a really simple system to do that because you've got complete control, and it's just a case of, well, let's just change that form. And actually the end user of that form won't actually notice a huge amount of change, because it might be we're just asking them to tick a box. And all they've got to do is tick the box on the electronic device. So there's no need, there's no thought. We can actually attach notes and all kinds of things. So in terms of integration and bringing additional data and improving KPIs and metrics and even changing metrics and KPIs at a day's notice, it's really easy to do.
So I'd ask Misha then, there is a growing trend that I've certainly seen over the last few years towards people who are commissioning contracts, putting out larger contracts which are demanding more information more regularly, that frankly just isn't possible to deliver with paper-based systems. And so a lot of people are missing out on the opportunity to take up those. And it's actually much more efficient, obviously, to do it electronically. Are you seeing that trend? And can you give a few examples of where that might manifest?
Oh, I'm the right person for this one. So in my previous life, I used to do the tenders and stuff for Walsingham support. And you can see in their requirements for the contracts of all the things they do want you to check, but not just that, the things they want you to be accredited to, signed up to STOMP about over medication, signing up to the restraint reduction network. So you can't just sign up to those. You've got to sign up to those and then monitor your performance to those and return action plans on those and all the different things. And they want numbers, and it's all these different things. So we're building mechanisms to check each and every one of those individually, and how we monitor and implement, and we can kind of benchmark ourselves against those. So when the phone calls happen, to get on the frameworks in the first place, you have to be on all these X, Y, and Z sorts of things, but you have to be able to demonstrate and keep those alive and keep compliant, show that using the principles of STOMP, you've reduced the amount of medication people receive for behaviors and different things. But the amount of restraint, it's new. We've signed up to the restraint reduction network as an example. We've got to say where we've started from, which we can push some buttons and get it out of Radar. But then we're going to be building in workflows. We've added additional workflows to Radar ourselves. We didn't call them, we just did it. And it says about chemical restraint, about physical restraint, about any cases of seclusion. So where before they used to sit under a behaviors that challenge sort of thing, they have now their own workflows. So we now monitor those through our safeguarding reports. And we've got those bespoke to the individuals in the homes. So if somebody's got legal authorization to use restraint, their name appears on the Radar list. And then the kinds of restraint we're legally authorized to administer to that person are on the list, but there's always another. So if somebody oversteps the legal boundaries, there's another to say, oh, we actually did this because it was different and it's not legally authorized. But that once they enter it, it alerts to the operations manager, and radar sends them a notice to go, ooh, illegal activity has just happened. It doesn't say that, but that's what it means. It says something illegal has happened at a service. You need to go check it out. And we use that kind of alert system for our safeguarding and for all the restraint stuff. So that way, when it comes to those monitoring periods where we need to tell the local authority because they ask, the one involved will, but we're using it for all of our local authorities. We don't just apply it to Swansea or to Middlesbrough. We make sure it applies to everybody, because then when we have those conversations in a different local authority in Sutton in London or something, and we go, oh, we can tell you we've done X, Y, and Z, it makes us look good that we know those numbers and we're monitoring and we're ahead of them, because all local authorities are in a different place. Some of them are still in 1982 and working on paperwork, and other ones are using all singing, all dancing software. So it's just being able to be ahead of the game where we can be and responding to needs when we needed to. So usually tenders tell us when there's a need and we get ourselves sorted and moving forward. And then we've educated local authorities in other places based on stuff we've learned in other local authorities. So it just makes it easy for us. And having those alerts to let us know that something serious has happened has been really, really effective. It creates more work, but there's really good steps to evidence what we've done. And this way, if there is a safeguarding meeting, a strategy meeting, and they say, when did you do X, Y, Z? Where's this? Where's that? We've got it all in one place. And if the manager gets hit by a bus, which is my constant joke, if they get hit by a bus, all the data is still there in radar. It hasn't died with them as it would have done with our old system. Sometimes we didn't capture enough of the questions and the knowledge that was happening, but now we do. And anytime there's an emergent need from a safeguarding strategy meeting or something happens, and just like Russell says, you might need to add a question to a workflow, and nobody notices that you've added a question, but there's a reason it's been added. And I just trained a new ops manager who's only been with the company for 4 days, and was training her yesterday to how to log an event on radar. And she's like, is that it? And she was waiting for more. I said, there isn't any more. That's really it. You just push this button and follow the path. And she goes, what if you did this? And showed her on Teams, if you logged a fire, this is what would happen. And she's like, that's very different. I'm like, yeah, because it's not medication. And so, and we did a COVID testing. It was very quick. Mm-hmm.
So I
Sorry.
think that's absolutely great. All this is really informative stuff that certainly helps with hopefully the people who are listening and able to really act on some of the thoughts that you're putting there that will be shared. I think the one of the more recent consultancies I did with a provider was really interesting, which was this was pre-COVID, but it was looking at making a choice about a business as usual tool or seeing it as an investment. And I think that's a really difficult thing as a set of trustees overseeing a third sector organization, or even just a smaller provider, on justifying the investment in a tool that will provide the benefits like these things are. And I'll come over to you, Chris, in a sec on how people make those decisions and how you support them on them. But more importantly, it cannot be seen any longer as just an investment. It has to become business as usual. That's the way and the direction of travel. But what I've seen has been, if you do a competitor analysis and you look at the people who are winning contracts and doing the delivery of care at your level, you can quantify the amount of contracts that you are losing against your competition alone. And that of itself is enough to justify why you have to take on these sorts of tools. So for Chris, I've got a question really, and it's in two parts. The first is, when is an organization ready to adopt a tool like Radar? How would you define it, describe it? What would be the first instances of what they should be considering taking on as an organization that is making their first sort of inroads into dealing with this sort of solution? And is there a ideal sort of setup that they should be in order to work with an organization like you? What sort of assets or people should they have in place in order to work well with an organization like yourself, bringing in those technical solutions?
Yeah, good questions. The first question, there's not an exact place to be. You know, they've got to. I think it goes back to what Russell said. They've got to be ready to bring that to the people who are going to use it. One of the big issues that people always come up with when they speak to me is, but the it's introducing a new system. People won't get it. They won't understand it. Misha and Russell have just explained how simple it can be for people. So the people that are going to implement radar within your organization, once they understand that, then the actual devolving it out to the rest of the staff that are going to use it, the users, so to speak, the ones that are going to log the incidents and do the audits and things, that should be really, really straightforward, because it's really simple. It's using a tablet or a phone or a laptop and just following a workflow. So once you've got that, once you understand what the workflows are and how efficient they can make that for your organization, then it's straightforward. And ultimately, most of the organizations we speak to already have these manual processes in place. We're just underpinning them. We're looking at doing that. We're looking at making it more efficient and better. And I would also add that you don't need to do a big bang all in one go. Where's the quick wins? I think Misha talked about, might have been Russell talking about, people using it and seeing the benefit of radar. So if very quickly you can roll out your audits using radar, the next thing, the staff will come to you and say, can we do something else on there? Or once you tell them it's going to be on radar, they'll know it's easy. So that's a real big point for people to understand from a project point of view. The next part to your question is, yes, you're going to need some people to be involved with radar and learn it. Super users, as Misha mentioned, a super user earlier. These are the people that are going to be the full administrators. These are the ones that are going to know how radar works and how your processes are set in there and done. But if you get that right, like Misha mentioned, you don't need to come back to radar. You can be self-sufficient. You don't need to come to us to spend some more money from a consultancy point of view to build something in there, because you can do it yourself. It's been designed and built to allow you to do that. And that's what we want from that perspective, so that then we can focus on developing the product and making it better and taking on board the things that people like Walsingham and Sequence are telling us, could it do this? Could it do that? We want to go and develop that, bring that back to our customer base and any new customers. So I think most people are ready. You've just got to have an open mind, and focus on what you can win. What I would always call a quick win. What can that help me do now as an organisation? And what's your problems? Is your problem the CQC wanting all that information, like Russell said? Why do I need to send you paper when I can do it digitally and I can do it as frequently as you like? If that's an issue for you, then have an open mind about whatever software that you're using, not just radar, but any software, and what benefits that can bring. Look at the value that it can offer you, and then work out whether that's going to benefit your organization. And if that's the case, then you're ready for a digital system. You're ready to take that step.
Okay. And I guess lastly, a question for Misha and Russell. If you could give the care community a single piece of advice based on, or learning, that you wish that you had known when you started this journey and were at your deepest woes, worrying about, making the decision to bring in technology, or employing a technology badly and perhaps having the institutional memory of failure and trying to overcome that, what would be your biggest lesson or advice to those people who are starting this journey and kind of need to understand a little bit more about how they can overcome those issues? I'll start maybe with Misha this time.
Two is, one, you've got to make, for us, we created a solid cemented date. After that date, we won't accept the old paper system at all. And you must be pushed off the cliff, I call it. You must have to use the new software, because some people are afraid. You make that hard and fast, and you make them cross the line. And then the other one, for us, it was about reducing the amount of admin to manipulate all these pieces of paper and different things, and having better management of your admin time. So I could use my administrators to do a lot more things than just sitting there collating data on Excel spreadsheets. So it's much more effective software-wise and business-wise to have the software do it for you. It's just easier. You're not running the risk of somebody breaking something. You can change it quickly, and sites all over the country can use it immediately. So digital for us, that's how far we've gone. We've not gone any further with electronic support plans or anything, but this suits us. And I would say bite the bullet and do it at some point, because it's coming.
Okay, and Russell?
Biggest part is, don't be scared of it, is number one. I don't think it's something to be scared of. People talk about culture change, and people may be resistant to changes in systems. And I think what Chris said earlier was a point in case that once people see it, use it, they want to use it more, and they find things to put on there. It's really interesting. They said, well, we record this. Can we record that? Yes, and that doesn't just go through radar. We do have support planning electronically, risk service user risk assessments electronically, and people are always trying to find a way. Well, I need to monitor that person for seizures, for example. Can I do that? Well, yes, you can. You can use one of these two systems. Okay, how do we do it? So I think it's, and the second one would be, it doesn't matter how much you think you know or how much you're being told is being done, until you get a digital solution, you cannot be 100% sure. For example, safeguarding alerts. Someone can tick a box on a form and say they've done it, but until you've got that piece of paper in front of you and the evidence, which can be attached, for example, to radar, I would have never known. I do now.
Brilliant. Well, look, thank you very much. We won't be running a live Q&A, but we will be capturing questions and answering them. Thank you. It's been a really insightful discussion. Hope we found it really interesting. Thanks to all of our guests today and to Radar Health for sponsoring the session. If you'd like more info on their software solutions, then the contact details will be put up on screen shortly. And keep an eye on Radar Health's social media and blogs for a roundup of the discussion. Thank you very much for joining, and enjoy the rest of your day.
Thank you.
Thank you.